uniongoze Bwana, uniongoze, uniongoze Bwana, uniongoze. Ni daktari Bwana, ni daktari, ni daktari Bwana, ni daktari. Baba, shika mkono Bwana, shika mkono, shika mkono Bwana, shika mkono. Baba, usiniache Bwana, usiniache, usiniache Bwana, usiniache.
My name is Miriam Miller. I'm a researcher at Berry College and a nursing student. I came to Kenya to get to know its people and to examine the structural and systemic causes of global health inequities.
There are not words that can express how thankful and joyful I feel being here today.
While in the country, I conducted mixed method surveys and interviews among healthcare workers to better understand their perception of their healthcare system. My interviews focused on tuberculosis, or TB for short.
As the sub-county MOH, I'm the one in charge of delivering public health services in Rarieda sub-county in Siaya County. Number one will be, because obviously infectious disease, we are talking about HIV/AIDS, followed more closely with respiratory tract infection. TB is also one of the main challenges we have, but we have a system of treating both the drug-sensitive TB and the drug-resistant TB.
TB is an airborne disease that infects approximately 10.8 million people around the world each year. It remains the leading cause of death from infectious disease globally, surpassing both HIV and malaria.
It's very tricky because sometimes, that's actually, if the patient tests positive, you're supposed to go and also to screen the family members, those people who have been around him. But you see this place, you find that there's a lot of resistance. Well, sometimes the family member will say that he doesn't want to be treated because he doesn't have TB. So it's a little bit tricky these sides.
During my interviews, I was surprised to learn that one of the greatest barriers preventing patients from receiving TB treatment was not a lack of access or diagnostic resources. In fact, many clinics and hospitals had more advanced diagnostic tools than those available in parts of the United States. Instead, it was a lack of education in rural areas that allowed stigma to become the most significant obstacle to seeking care.
Stigma in Kenya is a very common thing because in Kenya, most of the people, they do judge you based on the surrounding or the outside appearance, how they see you, and this one, it has caused people to withdraw from participating in the public forums, accessing to healthcare services, because one, when somebody is HIV positive, or when somebody is having maybe TB, for example, then people do relate this with prostitute. For one, well, people believe that when you are HIV positive, maybe you've gotten the viruses through prostitute work, or when you have TB, then definitely you are HIV positive. So people feel discriminated and stigmatizing, and now they withdraw. Instead of getting services to the Ministry of Health, then they would rather sit back at home, and this may lead to death, stress, and depression.
During my trip, our group spent a lot of time working with the Nongaya Foundation, a Kenyan NGO that equips widows in the region through modes of economic empowerment. I was thankful to have a conversation with its founder, Thomas Agutu, to better understand how stigma, poverty, and disenfranchisement contribute to patients suffering from TB and HIV.
In this culture, I'd like to let you know that it's a very, very proud kind of culture. Mm-hmm. And there are things that, if anything happens in your life that you feel like it will lower your dignity, you would rather just keep quiet until you die, but don't share with anybody. Now, HIV/AIDS affected quite a number of people. Many people in this culture took it as something like a taboo.
Yeah.
Mm-hmm. Not necessarily a disease. So they were relating it to, you have this problem of HIV because there's something wrong you did. So they brought in a lot of fear. And the stigma that came with it was so high. By the time he talks about it, it is late. Right. He cannot be helped. HIV comes with opportunistic diseases.
Right.
So TB becomes common. So when when I mention HIV, that is just the blanket part of it. But
Right.
there is a lot that now, when it comes to other diseases, that
Right.
comes with it. So TB is a major one, because those who have HIV are prone to having TB also.
Tuberculosis is often called the disease of the poor because it both stems from and perpetuates poverty, creating a vicious cycle of poor health and lost income. During my time in Kenya, I met countless driven and capable individuals, people eager to work, to provide for their families, and to build better futures for their communities.
Can you tell me your name?
Moses Otieno Oweno.
Nice to meet you, Moses. How long have you been fasting?
For almost 3 days.
3 days.
Yes.
And why are you fasting?
I'm just praying for a job, because I don't have a job. Job vacant.
Yes.
Yeah. So I'm hustling, but in Kenya, as per now, there is a difficult way to find a job. So I'm just come out to ask God how God can help me.
What type of job would you want?
Any job.
Any job.
Yeah.
It became increasingly clear that any holistic plan to combat TB in Kenya must address not only health system strengthening, but also economic empowerment. Without breaking the entrenched cycle of poverty that fuels vulnerability to disease, progress will remain limited. This approach aligns with the World Health Organization's End TB strategy and Kenya's national TB program goals, both of which recognize that reducing TB prevalence requires tackling its social and economic determinants alongside medical treatment.
The support really is advocacy so that it can reach every other place. You may be aware that a lot of advocacy has gone on, but I'm still calling advocacy because there are some pockets of population which are still unreached. If you go to Rarieda sub-county and other parts of Siaya, very much interior, they don't have the information we have in the mainstream. So that's the first step, so that we can let the people know what kind of help is there, what kind of plan is there, so that they can take care of their health.
I think first they need to embark on education. You send various personnel to the ground so that they can know how many people are suffering from this condition, how many people knows about TB, and what should they know. You will have to employ people to go to those remote areas so that they can spread the knowledge, so that they can know what is TB, so that they eliminate that stigma. I think we have indulged much. What I can say is that we have looked at the solutions, we have looked at what should be done, and the rearrangement so that we can ensure that the prevalence rate of tuberculosis is reduced and the endemicity is going down soon.
Yes.
Yes.
Yes. We can eradicate tuberculosis together, but it takes a global effort.
In the next installment of this series, I will be going to Capitol Hill, examining our own health system in the United States regarding TB treatment, and going to South America to continue my research. I will be partnering with Socios in Salud, global leaders in the fight to eradicate tuberculosis once and for all. We're going to Peru!